Good morning, everyone. My name is Stéphan Duchesne, and I'm a pathologist assistant for the histology department at Pasco Hospital in Regina. The title of my project is Optimizing Mastectomy and Excisional Biopsy Handling Procedures for Optimal Histologic Examination. My aim statement is, by spring 2020, the PH and RGH pathology laboratory will optimize compliance with extant guidelines with respect to handling, dissection, and tissue processing of mastectomy and breast excisional biopsy specimens to reflect high-quality patient care. In late 2018, we started noticing requisition discrepancies and specimen integrity issues received from our own ORs and some of the peripheral hospitals. We started to collect data to classify the type of discrepancies occurring and where they originated. Based on that, we felt it necessary to provide a refresher information session so that the staff involved in the pre-analytic phase understood the importance of proper specimen handling. Essentially, we were in PDSA without even knowing it. In September 2019, Cohort 4 began, and we tailored our existing data collection and information session to focus on breast specimens, as they seem to be the ones with the most issues. The proper handling of breast specimens helps us determine the biomarker status of breast cancer patient, and that information helps us to identify those patients who could benefit from hormonal therapy and monoclonal antibody therapy. The College of American Pathologists recommends that breast lesions be exposed to tissue fixative within 60 minutes of the excision time. Delays in fixation and, to some extent, overfixation have been attributed to false negative biomarker status, which could potentially result in patients receiving the incorrect or not receiving the correct treatment. The primary drivers for this research include current CAP guidelines, maintenance of CAP laboratory accreditation, best practice literature, and the number of recurrence reports related to ischemic times and specimen integrity. In September and November of 2019, we again delivered information sessions to OR nurses at Pasco and RGH, as they are the first team of people directly responsible for mastectomy specimen handling. These sessions address fixation with formalin, how and why biomarker testing is performed, and we address some of the discrepancies we had identified once the specimen was received in our lab. During this time period, we continued to collect data using a REDCap tool, data from our requisitions. The optimized dissection phase and optimized tissue processing phase of this project are still ongoing, so please stay tuned. Overall, we evaluated 191 breast specimens, and we found that 35% of specimens had at least one discrepancy, ranging from 1 to 3 issues per specimen. Ischemic time guidelines not met and information missing from the requisition were the most prevalent issues, occurring 35 times and 24 times. When we evaluated the data by number of issues, we saw that 32% of the specimens received had at least one discrepancy. We also found that 64% of peripheral hospitals had also at least one discrepancy. At the Pasco Hospital, the total formalin exposure time had a median of 67 hours, and at the RGH, a median of 31 hours, and CAP guidelines suggest 72 hours of maximum fixation. Some of the key learnings: quality does take time, and we have to expect the unexpected. It's important to engage and involve stakeholders early. And lastly, laboratory medicine, I find, is often misunderstood by a lot of clinicians, and then many people don't realize all the steps and people involved in generating accurate results. Thank you.